Hello everyone, I'm Dr. Viharika Pavuluri. I'm Junior Resident in Department of Radiology in SSMC Tumkur. Thank you so much for joining for this short presentation on research titled Role of Artificial Intelligence in Detecting Renal Stones in CT KUB Scans. This is published in IJSR. We'll go to the introduction. Renal stone disease is a common neurological condition where CT KUB imaging remains gold standard for diagnosing due to its high accuracy. However, manual interpretation of CT scans can be time-consuming and very inconsistent. This is where AI, particularly deep learning, steps in, and it is offering us rapid, precise detection of stones, including the details like size, location, even composition using Hounsfield units. This study evaluates AI's capability in detecting renal stones in CT-KUB with a focus on localization and HU-based composition advanced. Here you can see basic anatomy of the human kidney, and here the glomerular filtration, even the arterial supply you can see over here. We all know CT KUB is the gold standard for the imaging modalities, but however, X-ray, ultrasound, MRI, even IVU and dual energy CT also can be used for as imaging modality. Now coming to role of HU, Hounsfield units in stone characterization. In this study, HU values usually they come from CT scans and they represent the density of the tissue. For stones, that helps us to estimate their composition. For example, calcium stones like calcium oxalate or phosphorate typically shows high HU values. And uric acid appears low HU and they are radiolucent on X-rays. By knowing these HU values, it helps us for the treatment of the patient. For example, uric acid stones can be treated by alkalization. And high HU stones, we know that they're even more resistant to the shockwave treatment. So they might need ureteroscopy or surgery. We also use dual energy CT to better differentiate between mixed stones, the composition. So tracking HU over time, we also know the response to the treatment. AI in medical imaging. In context of renal stone detection, AI not only enhances the accuracy, but also supports the radiologist by reducing their workload and chance of missing subtle findings. Deep learning algorithms like CNN, convolutional neural networks, are specifically designed to recognize patterns in CT images. Once trained on a large annotated datasets, these models can detect stones and measure HU and even predict their composition in real time. This is especially valuable in emergency settings where fast decision making is very critical. AI also helps in predicting clinical outcomes and even based on both imaging and clinical parameters. And CT, the main thing is even the CT scanner settings and even the patient positioning, making diagnostic interpretation more consistent across different hospitals. So beyond renal imaging, AI is already being applied in prostate MRI, bladder tumor detection, even in progression of CKDs also. Overall, AI is not replacing radiologists, but it is empowering them to work smarter, faster, and with more confidence. And here the advancements in AI algorithms for renal stone detections, the advancement in AI development is like using large annotated data sets and techniques like data augmentation and data learning here. And one of the most thing is predicting treatment outcomes. This is most valuable. And there are many challenges that AI is facing recently, like data privacy and algorithm transparency, which could be dealt with ethical committee later. Future directions of AI and renal stones. This has even by combining the patient history and imaging lab results, this will give us a holistic assessment. And here we can see this is a training phase. Here all the multiple data acquisition is there and it will process the data. And during using the CNN, all these and this will experiment and it will come to a fair explanations. So after coming to that, we as a radiologist will decide if it is doing good or not. And if it is so, then we'll make it as a trained model. So this will be using in packs nowadays. This can be used. If not, we'll again train it for deep learning model, and this will continue. Over here, you can see this is the DECT axial non-contrast CT image. It is showing multiple tiny calculi in the mid-pole of the right kidney, and post-processed color map over here, and it is showing uric acid renal calculus in red, if you can see here. Yeah. And there are many challenges that AI implementation is facing for like in renal imaging. So imaging variability, for example, if there is any slice thickness variation or any contrast levels or any sites that it cannot pick up. So all these can be trained with multiple data, giving multiple data to the set and multi-institutional data sets, not even from a single institute, but multi-institutes CT KUB cases should be collected, and it should be trained for all the, even for the low variation and low clarity, all these also it should be trained. Even the data quality and annotation also, and the labeling and the variability, all these should be explored. Automatic annotations and consensus-based labeling strategies should be used. And model interpretability. So deep learning often acts as a black box, limiting clinicians' trust. Even the ethical and legal concerns should be underrepresented in underrepresented populations. We shouldn't take any bias, and all these ethical concerns should be managed. Here we can see, this is case one. Here we can see a staghorn calculus in the right renal pelvis with a calcified cyst, you can see here, which is very clearly depicted, and it is given as what is the size of it and what is the HU that it is showing in each and every stone. It didn't even miss a single calculi. So it will make, this is the original CT image, non-contrast CT images. This it'll make into this 3D kind of representation image, and it'll give us accurate measurement location, even HU. And this is one more case where you can see ureteric calculi and mild hydronephrosis over here, which is given. The report it shows hydronephrosis and even the calculi measurements and where it is exactly from the PUG. All these are clearly mentioned. And here these are the results where we can see the stone localization accuracy, which is this is by radiologists and the AI. It is almost equal everywhere, and even the stone HU measurements, even the based on stone composition, also based on HU, it is giving accurate result along with the radiologist. The massive thing that it is showing is the average time. The artificial intelligence take maximum, AI based tools will take maximum 2 minutes, but here radiologists be to assess, it'll take 15 minutes. That is why we are telling it is very massive in emergency settings where quick decisions to be made, and this will help us to guide and locate where actually the stone is, and it will be very time saving. And conclusion, here we can see AI strong performance in kidney stone localization and characterization. So these results demonstrates AI potential to support quick and accurate diagnosis and guide personalized treatment plans. So there is more future potential for this. That is what demonstrated our study. Thank you so much.